Next question. A patient comes from a factory with a chemical injury to the eye, and they are asking the first step in the management. Now, again, chemical injury, chemical burns, we have discussed this multiple times. Whenever it's a chemical burn and you know that it's a chemical burn, the first thing that you have to do is the copious irrigation. There, we cannot waste time in taking too much of history. We cannot waste time in doing the examination. If you remember, a similar kind of question we have done where the option that you had to rule out that what should not be done in that case was thorough slit lamp examination. And so many people have asked me so many times that why, ma'am, we don't have to do the slit lamp examination. I told you that we have to do the examination, but not now immediately, because actually it's a emergency condition. So it's a ocular emergency. I don't have to measure the IOP or visual acuity or slit lamp examination, nothing. If they have already told you that it's a chemical injury, it's a chemical burn, the first thing you have to do is the copious irrigation. So it can be acid injury or it can be a alkali injury. Alkali injury is actually the more severe variety because here we have more risk of necrosis. Because there is more risk of necrosis, therefore more risk of the perforation. That is why always alkali burns are more severe in comparison to the acid injuries. And for the treatment के लिए number one we have to do copious irrigation. Now, copious irrigation, if you remember that I told you also that they have asked, yeah. So, copious irrigation you can do with anything. If they are asking you best is the basal salt solution, right? But even if you do not have basal salt solution, you can do with the normal saline hai, ringer lactate hai, even RO water, distilled water, whatever kind of waters are available, we can go for this. Yes, if we are having all the things, then we can go with the best basal salt solution. Number two, we have to do the double eversion. Then we have to do double eversion to remove the deeply embedded. And I had told you deeply embedded tuna particles. And even I told you in the class how to do the double eversion. I told you that if you are not very fluent with it, then you can keep your take out the refill from your pen, or you can use this this kajal stick, you can use stirrers, you can use, just keep it like this, and over this you can invert it so that you can remove the deeply embedded particles. Then we have to do the debridement. That means we will have to remove the necrosed material, dead tissue you have to remove. And once we have removed everything, then we have to use the drug. So topical drugs may, first of all, we can give the steroids because there's a lot of inflammation. Then doxycycline or tetracycline group of drugs we have to use because they will prevent the perforation. And number three is the topical citrates, which are acting as a typical antidote. So, I don't find the history taking to be confusing option here, because they have clearly mentioned that it's a case of chemical burn. So that means you don't have to go back to the history and confirm that is it a chemical. So if the question or examiner has already told you, we don't have any right to investigate into the question. Is examiner telling me the right thing or should I? So if he told you that there's a blunt trauma, what kind of cataract it is, so again I will not go to the patient and ask the history, was it a blunt trauma or not. Then only I will decide that is it a sunflower cataract or it's a rosette cataract. Guys, they have told you in theory already that it's a chemical injury. So don't go back to take the history. You have to go with the first step, go with the copious irrigation. Okay, take my words, this is the right answer. Visual acuity and all can be done afterwards, no problem. And when we have intraocular foreign body, then we have to do the survey of the patient, then we have to take the visual acuity, you have to start with the antibiotics, and then you have to refer the patient. That is their protocol. IOP measurement is not at all required here, because IOP definitely can be high, because whenever we have this chemical burn hair, acid injury, alcohol injury hair, a lot of inflammation, inflammatory cells are released, they will definitely go and cause the trabecular meshwork blockade. Uveitis can also cause the raised intraocular pressure, so we are not interested in it. Oh, thank you, thank you. So, copious irrigation is definitely the right answer. I hope you have understood.